Thank you, Angela. And on behalf of our emergency management administration, Mr. Jackson isn't with us today because he's running another meeting at this particular time. He's working with the local emergency planning committee in preparation for future training, planning, development. So that's why he's not with us today. He did want me to make sure that you realize that today is the 70th day of operational work since our emergency declaration, and that the emergency management services continue to work with all the public officials as well as first responders, police, fire, and emergency medical personnel. He wanted you to know as well that our personal protection equipment for all of our responders right now is at a lower level. We have that equipment that we need, but we're still at a lower level, looking for more support from the state as they send more into our counties. We also are looking to build reserves for future needs, whether that is a resurgence of the COVID virus or whether it is some other event for which we need PPE. We are working as well in the EMA with the planning and preparation for things that are going on this summer, working with communities and municipal groups as they are looking at planning. It's kind of neat to see what's going on with graduations, and of course the health department as well as emergency management is working to make sure that we have that good physical distancing. The measures are in place so that folks can experience graduation and some of these other events, and we're grateful for that planning. As we look toward reopening, and we'll again walk through a couple of things that the governor is preparing and what we're doing here at the local level, we want to thank our local businesses for keeping things going. And we have a lot of folks that need support, and we're looking forward to this week as well as next week information about businesses that are reopening, restaurants that can go at 50% capacity. And so we want folks to be able to get out, be safe, and move back into the mainstream of life. We did have a report today, and I want to let you know that we have 200 positive cases in Grant County. We also have 20 that are have died, and that is right at a 10% mortality rate, which is higher than some of the state levels. And so we need to realize that this really is a serious situation. It's much higher than what a regular influenza type of situation would be during any given year. Across the states, we usually see about 50 to 60,000 people that pass away because of influenza, regular strains. We have seen almost 80,000 people already in a 9-week period die across the United States. So please remember again that this is a very serious situation that we're in. We want to use our personal protection, our mask, making sure that we're doing the hygiene things so that we don't get that infection and or spread it to someone else. And we appreciate you doing that. So what's going on with Grant County government? This week, we are seeing anyone that has an emergency appointment need, they can call in to the offices and make sure that they connect. Next week, which begins the state's phase 3 planning, will allow appointments with certain conditions. You can call in, make an appointment, and then go into the recorder's office, the auditor's office, the assessor's office, if you need to, for personal interaction there. But there are conditions. We will require, of course, a mask. We will require when you come into the building that you sign in, that you answer a few questions, and most likely you'll be having your temperature taken as well to make sure that you are not symptomatic of the virus at this time. Those are part of the conditions that are not only at the local level, but at the state and federal level requirements for us so that we can actually open that up to people. Then phase 4 with the state would actually happen on June the 15th, and that is open access. The doors are unlocked. People have that freedom to come in and move about to the different departments that they need to work with. Again, the big thing that we want to remind you about is don't go out if you're symptomatic. If you're having, a dry cough, if you're having pain as you're breathing, as you have a fever of 100.4 or higher, call your healthcare professional and talk with him, or call the emergency number at Marion General Hospital, and they will give you some information on what next steps you should be taking. We really are grateful for the way Grant County citizens have worked hard to make us see success. And we really have, I believe, without any shadow of a doubt. We've helped to flatten that line. We've contained the spread of that virus. And we're stepping out now, opening business, seeing things happen again. And I'm excited about that. I hope you are as well. I think about, as we finish up today, Jesus said, "My peace I leave with you. My peace I give to you. Not as the world gives, I'm giving it in a different way." Take that peace, be encouraged, and again, as always, be safe, be steady, be strong. Thank you.
Thank you, Commissioner Bardsley. So exciting to see our community open back up again. Now, joining us next, we will hear from Jess Allenball, Mayor of the City of Marion. Welcome, Mayor.
Thanks, Angela. Appreciate it. Great to have this opportunity to share with the City of Marion the information that we have worked on now as we progress, we hope, to a healthier state of the city. I will let you know that we now have the thermometers we need, so we are going to open City Hall back up next Tuesday, May 26th, for employees only. What we'll do then is we will test them as they come into work each day. At the transportation, citywide maintenance and transportation will have thermometers to test their employees as they arrive to work. City Hall will have a couple of thermometers to test employees as they arrive at work. One of the things we're doing is not just testing them. When they come in through the door, they're only going to be allowed to come in one door at work, and that's the McClure Street side, or the east side of City Hall. We have divides an entryway with 6 feet. X marks the spot for each employee as they come in to keep our social distancing. Then we'll do the scanner on their forehead to see if they have a fever. If they do have a fever, they'll be sent home and asked to quarantine. If they don't have a fever, we'll send them up to their office and they'll begin their day of work. Each employee will also receive 2 of these. We'll be giving them those to wear, and they'll be expected to wear them when they're at their station and no one around. They are welcome to take that mask off, but if they are approached by an employee, they should put the mask back on. We're going to practice that social distancing. We know that's one of the true keys to keeping the curve flattened. Our buses are continuing to run by appointment only. That's a 24-hour call notice. We now have 5 of the 8 buses with the plexiglass behind the drivers and on the right side of the drivers to keep not just the drivers safe, but the riders as well. We have new buses that are going to be arriving, and we'll address those as they come in. They'll be starting to come in the next few weeks, and those buses will also be made to be safer. The new buses have a shield behind the driver. The old buses that we have, which are only a few years old, do not have that shield behind them, so we've added plexiglass to the behind and to the right of each driver. Those buses should be all up to speed within the next month. We are still going to keep the playgrounds at city parks closed until further notice. Now, the governor is going to talk about that this weekend at some point. I believe it's Saturday night is the deadline for that. If they allow it to be opened up and the governor puts his blessings on it, we will probably open up our parks. And so stay tuned, look at our website, look at our social media sites, see what's happening with our playgrounds over the weekend. This is a big holiday weekend. We know that children are looking forward to getting back to a more normal way of life. Now, we're also trying to create a more safe and environment at our Parks Department. That's one of the most visited by the public environments that we have at City Hall. They come in to rent the garden house, make arrangements for the splash house, all kinds of different activities. So the park's a fairly busy place as we begin to open up to the public in the hopefully not too distant future. That's not now, but in the not too distant future, we've decided we need to make some changes, permanent changes in the Parks Department. So we're building a wall. You'll have a private entrance for the citizens, and the employees will have their own entrance to go back into their park offices. And we'll also have a large safe glass window with, we've seen them before. You can still do transactions underneath the window, but it'll keep both the citizens and our park employees much safer as we move on from this COVID pandemic. And really, that's all the changes we're doing right now at City Hall, but I would encourage you to stay closely tuned to our website and our social media site, because if the parks are allowed to open, we will open them once the governor puts his blessing on that. Please keep praying for our community. Keep your social distancing. If you don't have a mask, try to find one. Wear them when you're out in the grocery stores and retail places. But get out there and support those restaurants and those businesses They need you desperately. It's been a tough time for them. Again, stay socially distant, and we'll get through this together. Appreciate it.
Thank you, Mayor Allenball. And next, we will hear from Sarah Evans of Marion General Hospital.
Thank you. As more is learned about the novel coronavirus, treatment options are expanding and becoming validated. Marion General Hospital chose to engage with the Mayo Clinic trial for utilization of convalescent plasma as a treatment option for COVID-19 patients. Convalescent plasma is a blood product drawn from a previously infected individual that has been screened by a blood center and processed to safely infuse into someone who is ill with the virus. This process ideally produces and provides some boost of immunity for the ill individual to help fight the virus and recover quicker. MGH has been able to administer convalescent plasma to a patient who has successfully returned to home following hospitalization and this treatment. A medication that MGH has been researching for a number of weeks is a drug called remdesivir. This medication has shown to have positive results with individuals affected by COVID-19 that require hospitalization due to their symptoms. The federal government, through the Health and Human Services Department, has been providing allotments of this medication to the Indiana State Department of Health. Through daily communication between us and the state public health officials, MGH is able to request this medication for specific patients who may need this for their treatment. The communication and collaboration between healthcare and public health systems is what is allowing us to continue to be successful in our response efforts to this pandemic. As the focus has been much on COVID-19 over the past few months, we want to just remind you that MGH has still remained focused on the healthcare needs of all individuals. We have adjusted our processes in our primary care clinics, the MGH Express, our emergency department, for inpatients, and for surgical patients as well. By placing patients who are being evaluated for COVID-19 in designated areas, we are reducing exposure to individuals. After operating in this manner for a few months, we are happy to report that our plans are working very well. We encourage anyone who is needing medical treatment to not delay because that could create potential hazards to your health. And we want to assure you that we are taking all measures to be able to provide you healthcare services in the safest manner possible, and we continue to be here to meet your needs. Thank you.
Thank you, Sarah. We appreciate the update. Some good news coming from Marion General Hospital. And next, I'd like to invite Dr. Brad Lindsay, Superintendent of Marion Community Schools.
Thank you, Angela. Today I saw on the back of a truck a message. It was Jason Stepp's truck. The message encouraged me. It said, "United we stand," and I felt so good about that. And I looked a little bit lower. It says 6 feet apart. made me laugh. Yep. United we stand, 6 feet apart. I like that, Jason Stepp. How about you, Angela?
I like him. He's a pretty good guy.
I'm so thankful to live in our community. We live in a great community where people care for one another. They're kind to one another. They treat each other well. Just like a good neighbor, the people of this community are there for one another. Thank you so much. In Marion Community Schools news, this morning we had our first morning because we felt like in the summertime, Angela, it was going to get warm.
Right.
Not yet.
Right.
But it went great. 8:30 to 10. It's the same process. This will be through June. You enter kin to go through justice. But we're over 370,000 meals served. It's still going great.
Wow.
Thank you, everyone, for your cooperation and helping us get food out to the people and our children of Marion. Thank you so much. We are so excited about our students and all the great plans we have, enhancing for this summer, but for this upcoming school year. And so, Giants out there, join the Giant Nation. Get on our websites. For kindergarten enrollment, contact a principal. The websites give you the information. But Giants at every grade, we can't wait for the summer activities, but we're super excited about the upcoming school year. Please stay tuned to our school websites. Our Marion Giant class of 2020, they are phenomenal. They are record holders. So much achievement with over 301 graduates. We're thankful for them. If you get on our website, you can see some of those outstanding achievements of our 3.5 video celebration. Get on that website and celebrate our seniors. They are special. Also, our virtual graduation, and much, much more. Music and others. Just so much celebration of our class of 2020. It's forthcoming. May 31 is that beginning of that virtual celebration of the great class of 2020 and much, much more. Beginning July 1, the governor has allowed, and Indiana High School Athletic Associations have allowed, so schools across the state of Indiana can right now open up their campuses beginning July 1. That's for activities in buildings, activities on the campuses, athletic playing fields, and so forth. There'll be more direction forthcoming. Please check your school websites for that. And again, we'll continue to follow the governor's lead as we monitor this pandemic. So please stay in touch with that. We love our students and our families, and we are excited about the time that we can reunite together because we love you. But in that meanwhile, thank you for staying connected with our teachers, social workers, and principals. Thank you for staying connected to our websites. Thank you for all your support and your encouragement. We just love this community. May love, peace, and blessings be with us all.
Thank you, Dr. Lindsay. And I'd like to share some exciting news with you right now. WSOT has the honor and privilege of helping to celebrate our graduating class of 2020, and we will be broadcasting the Marion High School graduation on Sunday, May 31 here on WSOT TV, and we'll be announcing those times more specifically next week. But help us spread the word, and that way families can celebrate along with each other, even if they have to observe the social distancing measures that are being done right now. I also want to welcome Steve Wright. He is the Executive Director of the Grant County Family YMCA. And Steve, I understand you're about to open your doors.
We are, Angela, and we can't be any more excited. I am the interim executive director for the YMCA. Just took that job over, and I think it was 3 days after I kind of came in, we closed the building. Not a great way to start. But in the same token, we have done so much work at the Y that I think when you as members come back, you're going to notice a huge change in the Y, the way we look and the way we operate. And so I just wanted to kind of come on and tell you a little bit. We are opening up next Tuesday. So it'll be next Tuesday on May 26th. And it'll be the day after Memorial Day, starting at 5 a.m. And I'm sure, like most of, I'm like most people, this has really kind of come out. I don't know why, but I guess it's just sitting around and eating when there's nothing else to do, right? So if that has been a problem for you, we invite you down to the Y to be a part of our exercise program. But, you know, the thing I've found out about the Y since I've become the interim executive director, it's more about than fitness. Just to give you some things that we've been doing, we've helped the county set up the COVID testing site at our facility and allowing them to use that Studio B. That's a totally, completely separate building than the Y itself. So we want people to feel safe coming back into the Y, knowing that even the air handling system does not go in and infiltrate into the rest of the Y. So that's one thing. Second thing, we've been offering childcare for Marion General Hospital workers, and that's been going really well. We've had some people take us up on that and worked with the hospital, and that's just been a great success story, and we want to continue that. And then the third thing, and I'll mention this and more to come, had a great meeting with Shane Beal with Hope House. And so we're going to actually be coming up with a scholarship program for the people going through some tough times, kind of dealing with a bad choice that they made. And great people just made bad choices. And so we would like to help them not only from the spiritual side, but also the physical side of a rebuilding. So family memberships will be available to them so they can come down and be a part of the family here at the YMCA, but also rebuild their family as well. So those are just some of the things that we've been doing. We can't thank our members enough for staying with us. You know, we've been closed the last 2 months, and we've done draws both months. And very, very few people had asked for their membership to either be stopped or held or asked for their money back. And what that does, it allows us to do the programming that we know is coming up. And one of those programming that is coming up is camp. Camp is going to start up June 1st. And it's when I talk about camp, a lot of times, because I wasn't a Y person before, I'm thinking about going off to church camp and you're there overnight and all that kind of stuff. No, this is day camp. This is all through the day, and we'll be working with kids and things. We're going to have a ratio of 1 instructor to 10 children. And so we've kind of broken it down by CDC guidelines that we'll be doing, as well as following the governor's opening process on that. So we are so excited about welcoming you back, the members. And if you put on the pounds like I have, I know my regimen is going to start Tuesday, is when I'm going to start working out. I'm waiting until you come and visit me, and we're going to work out together, and we're going to shed some pounds. In fact, we may get a contest going, Angela. I'm going to see if we can get a contest going with some members and stuff and see how we want to lose some weight. But that's kind of it for me.
It sounds like a great idea. And I got to say, Steve, hats off to you, because I had a chance, I got a little sneak peek, a little private tour, if you will, of the YMCA, and wow, they have cleaned that place up. I have not seen it sparkle so much, maybe, Steve, since it was brand new.
The building was actually built in 2008, and we've cleaned all the carpets, all the restrooms. When you walk through the locker room, it doesn't smell like a locker room, which is a great thing, right? And like I say, I think when you come down, you're going to see a beautiful Y. And then make sure you take a look at the gym floor, because it's been stripped, waxed, and
it sparkles.
It just glistens. So thank you, Angela. Thanks for coming down.
Steve.
Thanks for letting us be a part of this. I know we're going to be possibly bringing on some other businesses as they're reopening, just to really kind of talk about what's going on in our community. And that's what I wanted to do today, was just kind of start that process of businesses being able to come on here and share their story about how they're opening back up. When you come in our front door, you will have your temperature taken. I'm going to be there at 5 a.m. on Tuesday morning and welcoming you. So if you want to come that early, come and see me. I'll be in a face shield so you can see me smile. And but we want to welcome you back. And but we also will be asking the 4 CDC questions. You know, have you been in contact with somebody that you know have it? Do you show any symptoms? And a couple other questions that we'll be asking you as you come in. And then with the temperature, then you're good to go. We've got hand sanitizer down there for you to use. Please, if you want to, you can use your mask. All our staff is going to be in mask, but you as a member, you do not have to be in a mask unless you feel so important or so inclined to do that. If you're highly susceptible and you have some of those traits that can really contract this virus, we would recommend that you wear your mask. But we're also going to be watching you on the treadmills, that nobody's kind of, because it is kind of hard to breathe in a mask, and we'll be watching you and just make sure you're safe. So the staff's been all instructed on what to do, and we can't be any more prepared for you. We want to see you. Thank you so much, Angela.
You're so welcome. Thank you, Steve, Director of the Grant County Family YMCA. Next, we will be joined by Dr. David Moore. He is with the Grant County Health Department. Welcome, Dr. Moore.
Thank you very much. It's nice to be with you. Thank you. And for Steve, who's first time he's been up here, but Steve has been working with the rest of us over there for these entire times that we've been doing these. 70 days. It seems like a lifetime. A whole lot has changed for all of us in that period of time. We watched from over in China, then in Europe, and then it came to the United States, and it went over there, but finally it came and it hit us here. And so that, and we've had a team that's come together to prepare and to deal with that. And it's been a long, long journey to get here. When this first started, what we had was a runaway system of infections and other things that were in some cities actually overwhelming, and others threatened to overwhelm the resources. And doing what we were doing and being afraid wasn't really stopping it. And we had to stop and make some changes. And we made some changes, and the thing that we identified that made the most difference was social distancing. The virus is still the same, the human body is still the same, but we did something different, and it slowed it down. We can't do that forever. We need to reopen our country. We need to reopen our county, but we need to do it in a thoughtful way, and we need to monitor and respond. You hear over and over again about this new normal, and there will be a new normal, because if we go back to what we did before, we're going to get what we got before. And so how do we go about opening and thoughtfully doing it? It means that we're sensitive to one another. We know that it's going to be a different way than what it was before. We can do this, but it's going to take us being patient and persistent, in doing this, and let's learn as we go along the way. There are going to be lessons that we didn't know before that we're going to know now. I talked last week about learning how to protect the respiratory system, which supports the other system, learning what kind of early intervention that's come along, that now our hospital has the antibodies that they've used. Is it proven yet? No. Does it will kill everybody? No. But is it a step forward? And we're making many steps forward that is available. There's a new treatment, potential medication for treating it that we're going to learn more and we're going to get better. But in the meantime, we have to recognize that our body is still the same. The virus is still the same. If we go back to what we did before, that we're going to get into trouble. And so we want to, at the health department, to work with you, with our government. We promised when we first started this that we would be honest, forthcoming, and transparent about what we do. And we'll continue to be that. There are going to be a lot of missteps that everybody is going to make in this. And I ask you to be patient and tolerant with it, to knowing that people are coming and doing the most honest thing that we did. You've also heard me talk from the beginning about testing. And testing has a couple of different aspects. There's a testing that has to do with acute care in the hospital. You present sick. There are things that they need to know, and they're testing that they need to do. There are other kind of testing that has to do with things that go on in the community. A small shop of 10 people that is constrained by their walls, and they need to work together, and there's somebody there who's at risk. He's wondering, what's the health status of the other people who are here? The sports teams that start to get together again and want to know, as we start this activity, are we creating a problem? We can wait until we see the top of the mushroom cloud when our ICU is overwhelmed. But our health department is looking to see, can we find a way to know early on if that's going? And we're looking to work so that, as I've been health officer, been a year and a half now, one of the things that I wanted to do was for our health department to be a part of the community. We consider ourselves public servants, and we've got our things inside of our wall, but we haven't very much reached out into the community. And this is one of the things that we wanted to do, to provide a learning environment for our students, so that there were some students who came forward and said, I want to be a part of this, some college students. And we had an excellent person in our representative, Ann Vermillion, who has excellent managerial skills, and say, can we, with the availability of the health department, serve our community better? Can we ask some questions? We get numbers from the state. What does that mean for Grant County? We hear that the ethnic community has greater numbers and greater severity of it. Why is that? What's causing it? Can we do anything to try to make that better? We're going to look into that. We're going to see also, this is just not about numbers. This is about individuals, people who've been touched by this. And we want these students to meet them and talk with them and to bring their story and share their story. We've got pre-med students and hospital administration students and health law students that have come together to try to bring this information. And some of them may be coming to you to ask, can you participate in this? Can you be a part of this? This is a long battle. It won't go away, and it won't change just because we're frustrated at being locked up for a long time. We'll manage it because we intelligently respond to the fact that the old normal got us what we had before. A new normal can get us there. We work with love and commitment. With God's help, we'll get through this together. Thank you.
Thank you, Dr. Moore. Really important information, and exciting to know that our community is opening back up, but also incredibly important to maintain those extra measures of precaution just to help keep that spread at bay. Well, I want to remind you that today's broadcast is going to be aired here again on WSOT TV at 5:30 p.m. and then again at 10:30 p.m. and additionally on Sunday, May the 24th at 10 a.m. and at 5:30 p.m. I want to say another great big thank you to our local media, the Chronicle Tribune, WBAT, the News Herald, and the many others that are helping to spread this word. And we now return to our regularly scheduled programming. Thanks for watching.